mental approach that supports people in making decisions about their drug use or sexual behaviors, for example. LGBTQ plus people may reduce drug-related harms by knowing and managing the risks associated with particular drugs, choosing less risky drugs, or planning ahead for safer use, as well as by seeking treatment and reducing or eliminating substance use altogether. Examples of harm reduction the pharmacy teams can offer patients include opioid agonist therapy, in which patients receive either methadone or buprenorphine naloxone from a pharmacy to prevent withdrawal and cravings of illicit opioids. Opioid agonist therapy often helps bring stability to an individual's life and can reduce the harms associated with their drug use. Naloxone is an important harm reduction initiative for LGBTQ+ individuals, given the prevalence of substance use disorder in the population. I have had LGBTQ+ patients at the pharmacy who did not know of the program, and they were grateful to receive the kit. For individuals who continue to use substances, it is important to encourage them to not use alone and to ensure their peers also have training on administering naloxone in the case of an overdose. Pharmacists can provide unbiased and non-judgmental education on various health topics and harm reduction offerings. Some pharmacies host education events to educate the public on opioid agonist therapy and other supportive initiatives. Peer support programs are an important method of harm reduction in the community. Pharmacists can encourage patients receiving opioid agonist therapy to participate in support programs or consider hosting a program at the pharmacy. PrEP refers to pre-exposure prophylaxis. It is a harm reduction approach for those at risk of acquiring the HIV virus. The first medication used for PrEP is tenofovir and emtricitabine, but there are others on the horizon. When PrEP is taken daily, it's a combination tablet taken daily. It's been shown to be 99% effective at preventing the transmission of HIV. Adherence was very important, so you can't miss doses to have that effectiveness. PrEP is recommended for men who have sex with men and transgender women engaged in condomless anal intercourse, and people who inject drugs if drug paraphernalia is being shared. Pharmacies may be able to partner with local health units and become a source of free condoms and needles for the community. If the pharmacy is not able to offer these supplies for free, then the team should know where in the community to direct individuals. Safe injection sites available in some cities, such as Vancouver and Toronto, are another example of a harm reduction approach. Recently, some safe injection sites were closed and others had their funding discontinued. Safe injection sites have been proven to reduce deaths from opioid overdose for those living in proximity to the site. A successful harm reduction initiative in Portugal involved the decriminalization of possession of drugs for personal use, which resulted in a reduction of drug-related deaths by 59%, a reduction in HIV infection among people who recently began using injectable drugs of 17%, and an increase in admission to drug treatment programs by 147%. This is a fairly current news. A physician, Mark Tyndall, is planning to dispense hydromorphone tablets to individuals with substance use disorder at Vancouver's downtown east side to prevent deaths from fentanyl-laced street drugs. The machine will scan a patient's hand using a biometric scanner prior to dispensing hydromorphone tablets, individuals will have a set amount of tablets they can access, and they can and the doctor will issue a prescription for them to use this machine. Data from BC Coroner Service shows that between 2016 and June 2019, British Columbia had 4,559 deaths from opioids, and just over a quarter of those were in Vancouver. So again, I'm going to shift direction in this presentation, and we're going to talk about unique challenges LGBTQ plus individuals experience accessing healthcare. We have evidence that LGBTQ plus people are less likely to seek healthcare or social services and are often hesitant or afraid to disclose their sexual identity to their care providers. There are many barriers in healthcare that LGBTQ plus people are confronted by, one of them being limited access. Access has been identified as a concern, and some LGBTQ plus youth may lack extended health benefits due to family rejection, employment discrimination, or homelessness. Some services required may not be covered by insurances or provincial health services. For example, gender-confirming surgery, it varies across the country based on which province you're in. And also with access, it's to do with provider knowledge as well. So if you're from a small community, it's maybe less likely that you have a physician or a nurse practitioner there that understands your unique needs. So some of these patients have to travel long distances to seek health care. There's been many reports of negative experiences when accessing healthcare reported. For example, discrimination. It can be a challenge to find healthcare for LGBTQ plus people where they feel included and accepted. Negative encounters could happen while interacting with any staff, including at the pharmacy. Examples of negative experiences in healthcare reported by LGBTQ plus people include outright refusal of care, insensitive comments, or criticism about appearance or behavior, jokes, or slurs. Some bad experiences by LGBTQ people are unintentional and are due to a lack of understanding about how to interact with LGBTQ plus people. A lack of training in caring for this patient population has been widely recognized, and universities are adjusting curricula to address the gap. And many LGBTQ plus patients report having to educate their own providers about their issues, needs, and risks. Others report having to travel long distances to find a qualified practitioner. It is important for pharmacists to understand the barriers that exist in healthcare so that we can begin to position pharmacies as positive spaces for these people where they feel welcome. The barriers we have discussed have been found to delay medical care of LGBTQ plus people, and in some cases, individuals may not receive treatment or important screenings at all. Pharmacies can be an important safe space for LGBTQ plus patients. All that's required is some basic knowledge and training, and then we can help foster welcoming pharmacy environments for all patients. When LGBTQ plus individuals feel nervous or uncomfortable or unsafe, they may conceal sensitive health information needed to provide optimal care. Pharmacies and pharmacists should be prepared to serve any patient in a compassionate and respectful manner, no matter their identity. A bad experience with a healthcare professional has been found to push LGBTQ plus patients away from seeking further care and increases mistrust in the healthcare system. Careful communication can lead to the development of a trusting relationship between patients and the pharmacy. Conversely, poor communication can worsen the relationship and establish barriers to care. Fundamentally, it is important for staff to avoid making assumptions about gender identity and sexual orientation. Listen to how patients describe themselves and their relationships and use their own words. If they call themselves gay, then do not use the word homosexual. Homosexual, in fact, has negative connotations and should be avoided. When a female patient refers to her wife, then we should also refer to her partner as her wife rather than her friend. It is important to avoid making assumptions. While collecting information from patients, don't assume the partner or spouse to be of the opposite sex. Rather than saying or asking, do you have a wife? Ask, are you in a relationship? Don't assume the patient has a mother and a father. Instead of asking for the mother or father's names, ask, what are your parents' names? Be mindful of nonverbal behaviors such as facial expressions, body language. For example, staring at an individual when their appearance surprises you is not acceptable. Ensure there is no gossip or disrespectful language used among the pharmacy team to describe an LGBTQ+ patient. It is not possible to guess a pharmacy patient's gender identity based on their name, physical appearance, behaviors, or voice. When addressing a patient for the first time, avoid using pronoun terms that indicate gender. Rather than asking, how may I help you, sir? Ask instead, how may I help you? Initially avoid using Mr., Ms., Miss, Ms., etc. One option is to address the patient with the first or last name. For example, I see this prescription is for James Morrison. Is this for yourself? The pharmacy team should avoid gender pronouns. If you are uncertain about a patient's gender identity when speaking about the patient, if possible, the pharmacy or institution should have a registration system that allows patients to declare their pronouns, gender identity, and preferred name. Once this information is available, it is important that staff use the correct names and pronouns consistently. This system is helpful for non-transgender people as well, because people have nicknames or names that they prefer to be called, for example, by their middle name instead of their first name. Keep in mind that some individuals may use non-traditional pronouns, such as ze or they. If the correct pronoun has not been recorded, then it is acceptable to ask politely what name and pronoun the patient would like to be called. For example, ask, I would like to be respectful. How would you like to be addressed? Or what names and pronouns would you like us to use? And that information should be asked, privately and discreetly. Once this information is obtained, it should be documented in the patient record and followed by all staff. Some healthcare facilities list employees' pronouns on name badges, which sends a message to the patient that pronouns are respected. Changing one's official government or private insurance records may take time. You will likely encounter a patient whose name, gender, or appearance do not match their ID or insurance. It is important that you have a process to navigate this at the pharmacy. For example, locate a patient file with another identifier such as phone number, address, or date of birth. Have a process to politely explain to the patient why the name on the vial may not be their chosen name. We should make it clear to the patient that we recognize their preferred name is their real name. Some softwares allow to put a different name under the insurance tab compared to the main profile, so that's another potential workaround. Avoid dead naming or misgendering, as it can be quite distressing to the patient. Dead naming is referring to a patient using a pronoun or using a name or a pronoun contrary to their gender identity, or using a pre-transition name. So if you use a name they no longer use, that's considered dead naming. If a mistake is made with regard to pronouns or name, it is important to recognize the error and respectfully apologize. For example, I'm sorry for using your wrong name. I did not mean to disrespect you. It is important to foster an accountable environment in healthcare. If coworkers are using the incorrect pronouns or names, it is important to politely correct them, ensure that all insensitive comments are dispelled. When an LGBTQ plus individual accesses healthcare, they may look for signs that this is a positive space and a welcoming space for all. Examples of ways to signal that the pharmacy is a positive space include a posted non-discrimination policy. Positive space signs usually include the rainbow triangle and signal that the facility is welcoming to LGBTQ plus people. And the positive space sign you see on the slide is available from Rainbow Health Ontario if you'd like to order it. If possible, registration processes that permit patients to declare their name and pronouns can make a big difference in ensuring you're always referring to the patient using the correct identifiers and consistently. Gendered washrooms can cause distress for some individuals, in particular trans patients. Having any gender washrooms is suggested if you have a washroom in the pharmacy. So not male and female, but washroom for all, doesn't matter what your gender. Pharmacy teams interested in becoming competent in providing care to LGBTQ plus community may wish to seek out diversity training for all the staff. And diversity training is offered by several different organizations. LGBTQ plus patients may be receiving other medications aside from opioid agonist treatment. A fundamental role for pharmacists is to ensure opioid agonist therapy is not interfering with other prescriptions such as hormone therapies or antiretrovirals. Pharmacists can be mindful that LGBTQ plus patients may have additional comorbid conditions that require our attention. For example, there is a greater incidence of mental health conditions such as depression, PTSD, and suicide in this population. Other chronic diseases that disproportionately affect LGBTQ plus patients includes cardiovascular disease and diabetes. Attending today's presentation will help pharmacists better understand the unique challenges confronting LGBTQ plus people. All pharmacies should provide inclusive care and fundamentally be an ally for the LGBTQ plus community as they access pharmacy services. At times, LGBTQ plus people may have been subject to poor experiences while accessing healthcare services. In being informed on LGBTQ plus health needs, pharmacists can provide welcoming and understanding care to these patients. There have been a number of privacy breaches in the healthcare of LGBTQ plus people, and more specifically, these include disclosing medications allowed while other individuals are present in the pharmacy, such as hormones or antiretrovirals. There are also examples where pharmacies outed individuals as transgender by failing to provide privacy or overtly making a scene at the pharmacy. A key feature of harm reduction is providing non-judgmental care to individuals. It is important for pharmacy staff to treat LGBTQ plus patients as equal to others and not pass judgment with regard to substance use disorder, identity, orientation, etc. And this is important to dispel stigma at the pharmacy. There are some drug interactions between opioid agonist therapy and medications commonly prescribed to LGBTQ plus people. This slide is certainly not an exhaustive list. Opioid agonists, including treatments such as methadone and buprenorphine, have known interactions with certain antiretroviral medications, particularly efavirenz, and with hormone-modulating medications such as spironolactone. Efavirenz induces CYP P450-3A4, which then decreases the level of buprenorphine. Therefore, some patients may require larger doses of buprenorphine to prevent opioid withdrawal. With regard to methadone, again, efavirenz induce CYP P450-3A4, thereby that would reduce the level of methadone. And there's been cases where this has precipitated opioid withdrawal when we started efavirenz in a patient on methadone. Therefore, dose increases of methadone may be required, so the patient should be monitored for withdrawal. Spironolactone has been shown to increase methadone clearance by CYP3A4 induction as well. Known or perceived interactions between these and other medications may deter some patients and providers from initiating potentially life-saving treatments for opioid use disorder. Treatment should not be omitted for this fear. Most interacting meds can be co-administered with monitoring. When we compare buprenorphine and methadone, buprenorphine is thought to be the safer alternative and have fewer drug-drug interactions compared to methadone. I'd like to take you through a case example with Jack. Jack is a fictitious patient, but the experiences of Jack are real experiences that have been reported. So Jack is a young trans man. He was violently rejected by his parents when he identified himself as transgender. Junior high and high school were difficult times for Jack. He attended a rural high school and was subject to verbal harassment and abuse by fellow students. He began to misuse opioids and have just to have a timeout from his stressful life. Now he suffers from PTSD due to his past violent experiences, and he often feels isolated and depressed. When Jack went to the pharmacy to fill his prescription, the pharmacy refused to call him by his name Jack because his health card said Jackie. He found the dead naming to be distressing. They refused to call him by Jack because Jackie was on the health card and it was illegal to change the records according to the pharmacy. He went to another pharmacy, and at that pharmacy they refused to fill his prescription. The assistant refused to accept him because it was against their moral beliefs. And now he's been referred to your pharmacy because he heard it's a welcoming space for all patients, but he's still cautious. So Jack presents to the pharmacy, and you, the pharmacist, overhear the assistant calling him Jackie, and you witness him becoming visually distressed. You arrive at the counter and ask politely if you can help. You take Jack to a private area of the pharmacy, and Jack shares his previous pharmacy experiences with you, and that he's worried today is going to be a reiteration of those experiences. He tells you he was unable to update his health card yet with his true name, and he was hesitant to come in today. So you recognize Jack is quite distressed, and you apologize for the assistant not calling Jack by his correct name, and you offer to update the patient profile with his names and pronoun for future reference. You share with Jack your own pronoun and express that the pharmacy wants to be a welcoming space for him as he begins his treatment for opioid use disorder. You then book a medication review with Jack and enroll him in your pharmacy's opioid agonist therapy program. Wrapping up the presentation, these are some supplementary readings If you are interested in this area, there's some additional reading out of the National LGBTQ Health Center in the US. A couple good reads there and additional references. Thank you all for listening to the webinar. I hope that you leave this session and consider implementing some of these practices in your own pharmacies. Some small changes can make a big difference in connecting with LGBTQ+ patients and thereby developing optimal therapeutic relationships. Thank you.